Hi guys, today I will be sharing with you guys about shoulder radiograph, more specifically about shoulder radiographic anatomy, approach to reading the shoulder radiograph, and the common pathology seen in shoulder radiograph. So a few radiographic anatomy of the shoulder that you should know. Okay, so first of all, this is the right clavicle. Okay, next this is the acromion of scapula. Okay, and then this is the scapula. Okay, and then next this is the coracoid process of the scapula. Okay, and then this is the glenoid fossa of the scapula. Okay, and this is the head of humerus. Now we move on to how to interpret or read the shoulder radiograph. So first of all, look at the outline of the bone cortex. It should be smooth. So outline the humeral head, outline the glenoid fossa, outline the body of scapula, and then outline the clavicle, the acromion, the coracoid process. So look at all the radiographic anatomy that you have seen, and then ask yourself, is there any fracture? Is there any fracture fragments? Also, don't forget to look at the ribs and see if there is any fracture. Okay, outline the cortex for each ribs. Secondly, look at the glenohumeral joint. So the articular surface should be parallel, the humeral head should be on the glenoid, and if the humeral head lies under the coracoid process, here this is the coracoid process, if the humeral head lies under the coracoid process, then you should think of anterior shoulder dislocation. Okay, thirdly, look at the acromioclavicular joint. So the inferior border of the distal clavicle should be lined up to the acromion. If there is any step, think of acromioclavicular joint injury. So if the acromioclavicular joint distance is more than 8 mm, think of AC ligament rupture. So if the coracoclavicular distance, so this is the coracoid process and this is the clavicle. So if the coracoclavicular distance is more than 13 mm, so think of coracoclavicular ligament rupture. And lastly, remember to look at the ribs, as I've mentioned before, and also the lungs. Look for pneumothorax. Is there any pneumothorax? And also for Pancoast tumor. And also, don't forget to look at the soft tissue for any swelling or edema. So now we have a look at the common pathology seen on shoulder radiograph. So in this shoulder radiograph, we identify first the structure. This is the right humeral head. This is the glenoid fossa, and this is the coracoid process of the scapula. So this patient's humeral head lies anterior, medial, and also inferior to the glenoid fossa and also coracoid process. So this patient is having right anterior shoulder dislocation. So this dislocation is usually associated with Hill-Sachs defect or Bankert lesion. So don't forget to look for this abnormality. So now we have a look at another shoulder radiograph. And in this radiograph, we see that the glenohumeral joint is widened. And the humeral head has a more rounded light bulb shape. So this patient have a right posterior shoulder dislocation. Lastly, we have a look at another shoulder radiograph. So this patient radiograph demonstrates superior displacement of the distal end of the clavicle, and there is associated soft tissue swelling. There is also widening of the acromioclavicular joint, which is more than 8 mm, and also widening of the coracoclavicular distance, which is more than 13 mm. So this patient can have a right acromioclavicular joint injury. Okay, so that is all for today. I hope you all have learned something from this video. I also hope that it will help you be more confident in reading shoulder radiograph and improve in your patient's care and management. If you like my video, hit the like and subscribe button for more videos. So have a nice day, and I will see you in my next videos. Bye.